the Mahadaya, the knowledge discussion that has enlightened the lives of many, many Buddhists and non-Buddhists across the world. So today as well, folks, we are about to lead a very important discussion through the Mahadaya with a special resource person whom I'm going to introduce to you within the next few seconds. Now, through the Mahadaya, as you all know, we through the Buddhist channel try to add something important to your life and lead a discussion with a particular expert of a particular field and have a little bit of conversation with relationship to Buddhism as well. So today as I told you, we have a special resource person who is none other than Professor Ravindra Singha. So Professor Ravindra Singha is a consultant physician and gastroenterologist of Sri Javadanapura Kotte Hospital. He is a doctor of medicine, fellow of Royal Colleges of Physicians, London, Edinburgh, Glasgow and Ireland, fellow of the American College of Physicians, American College of Gastroenterology, American Society of Gastrointestinal Endoscopy, fellow of Ceylon College of Physicians. So he is a medical doctor, as you can all see. So I'm sure you would have guessed the theme today. Definitely, you're correct. It's Buddhism and Western medicine. So we warmly welcome you to the Mahadaya. And as the first question, I would like to ask you, shall we talk a bit about the evolution of Western medicine?
Yes, Vande, actually now if you talk about the evolution of Western medicine, it is only a couple of centuries old, right? But at the outset I should mention that religion and medicine had been integral components of all great civilizations. Now when you trace back the history, the oldest civilization is of Egyptian origin. Now there also they had a religion, but not the religion that we follow, right? Their religion had been sort of based on believing in spirits and evils, but their medicine had been sort of very advanced stage. If I just can show this picture from this book, which is about Egypt, right? Now, if you see this, now in our prescription, we sort of begin with a symbol called Rx. Now, if you see this, this is the R that we have taken from the Egyptians, not we took it from the Egyptians, but the Greeks took it from the Egyptians. Now, if you look at this symbol, right, you see this R there, which stands for protection, and also you will see the medicinal bowl downstairs, and eye here, which is the eye of wisdom. So they had actually the concept of medicine from that time onwards, which is about more than 5,000 years old now, and also in the literature they have described about 600 medicines and also a whole heap of body applications in Egypt. From there we move on to the other civilizations like the Indian civilization. Then we also had our Sri Lankan civilizations, which is far ahead of the European civilization. And when you talk about the Indian civilizations, right, you had two components of medicine. One is the medicine prescribed by their own Indian doctors, right? And then when we come to the era of Buddha, Buddha himself described the concept of medicine, which is for somatic diseases and for diseases well beyond the somatic diseases.
All right.
And when you come to the Sri Lankan history of medicine, We have all heard about King Buddhadasa, who performed surgery on a snake, right? So we also had a lot of other treatment, local treatment with medicinal baths and decoctions and various other plant herbs. Then we come to the concept of Western medicine, which is only a couple of centuries old. And when you go into the origin of Western medicine, the concept is that you observe something, then you design what we call a clinical trial.
Okay.
Right.
Yeah.
So you have your objective or the hypothesis, then you design a trial and you get the results and you document that. Sometimes you may get a positive result, but you expect to see, and sometimes you will get a negative results what you may not expect to see. And from time to time these are actually written down in various journals, and then that is how the Western medicine has started. One important thing is, over the years the observation made by the very old people or those who started these things have been rejected by the others who have designed better clinical trials, larger clinical trials, multi-center trials, and also what we call international trials, which does not involve only a single country. Right. So, you see that the concepts of Western medicine had been changing all the time, and you get two types of trials there, what we call laboratory trials and also the community trials.
Okay.
Now, laboratory trials, the important difference is you utilize animal models, and at the end of the day these animals are sacrificed.
Okay.
Right. So, there is actually pranagata or loss of life
Yeah.
when you design laboratory trials in Western medicine.
Yeah, definitely.
Right. And also in community also you have to actually use patients as well as a control group, what we call healthy volunteers, right, and you have to try a particular drug on these people, and you see whether this drug is beneficial for a particular group of people. So, that is how it has actually originated, and the most important thing that you have to realize is that there had been additions and deletions to the medical literature, and it is contributed not by a single person, but many people, and not limited to a single country, but there is a global distribution of contribution of knowledge. Now, if you take Lord Buddha, right, we come to that, his doctrine has been described by only Lord Buddha.
Definitely.
And when he attained the noble enlightenment, he knew everything. So, when he started to sort of preach what he have learned, he had the entire alphabet with him. So, we call A to Z knowledge. But in Western medicine, you start from A, then you come to B, you come to C, and still we have not come to Z. So, there is a long, long way in the Western medicine to go. So, how did Buddha acquire this knowledge? Now, he did not use community trials, he did not use animal models. So, my belief is that throughout the long journey of samsara, he has observed certain things, and he have gathered certain positive things which should take you to Nibbana, and certain negative things which would actually take you away from Nibbana. Right. So, he have synthesized and accumulated all his knowledge and experience during samsara, and when he attained the great enlightenment, he was able to tell this to the people.
Okay.
And he in fact he had a little ambiguity that when he attained the Great Enlightenment, as to whether the people would understand what he has gained. And then everybody knows that he had been invited by the Brahma Sahampati not to think like that. There are people who will understand what you are going to tell. And it is very important to realize that to understand what Buddha says is what you need is not the knowledge, but what you need is wisdom, prajna. Right? So, this might be one of the reasons why Buddha did not select a place like Egypt to be born. Right? Yes. They had the knowledge, but they did not have the wisdom.
True.
And their beliefs are totally different. But engineering wise, they were masters. And other important thing is that when you take the history of all Lord Buddhas, they are all born in Madhya Desha. And where they attained the Great Enlightenment, and also where they preached their first sermon, Dhammacakkappavattana Sutra, and also where they go to Tavatinsa, Sankassapura, the present Lord Buddha's place where he went to Tavatinsa to preach Dhamma to his mother, and also where the Buddhas attained parinirvana have remained the same. So, all Buddhas have to select India, for that matter, to be born. That is why he did not select any other countries to be born. So, that is one of the explanations. Lack of wisdom in these people, and also he has to follow suit what the other Lord Buddhas have done. Right. So, having said that,
now I would like to interrupt you with this, because you know, now you just happen to sort of describe the evolution of Western medicine, and we just began talking about Buddha and his supreme enlightenment and all the understanding he gained after that enlightenment. Now, sir, before we just started this discussion, two of us had a discussion, and you just happened to coin this term Buddhist medicine.
Yes.
So, can you continue from just taking that into consideration?
Actually,
what is Buddhist medicine?
Let's say one thing. Now, Buddhist medicine is actually, I see in 3 ways, right? What Buddha has told about the body and the diseases, and then what medicine Buddha has prescribed. Now, he has had vast knowledge in medicine, although it has not been put into practice, but he has prescribed medicine for his disciples, and also he has had his own pharmacology, which is actually, if you take this, the Samatha Pasadika Vinayatta Katha, this is actually the Sinhalese version of
you
what
can show it to
what
viewers.
Buddha has prescribed in his medicine. And also emanating from this, there have been several other small booklets produced by various authors. Now, this is titled as Tripitakaye Vishmita Behet. So, there Buddha had prescribed medicine, but he did not do this practice very widely. Second thing is, Buddha also had, apart from prescribing medicine, he has his own classification of diseases, his own anatomy, physiology, everything, which I am going to go in detail. So, the third part is, Buddha has not only treated or talked about the physical disabilities, or what we call bodily somatic diseases, but his main treatment is beyond somatic diseases, which would lead you to attain Nibbana. So, in that context, he has also told in the golden saying in Kalama Sutra, right? He has told that not to believe anything unless you have realized it for yourself that it is true.
Sure.
Now, this is the very basic principle that we observe in Western medicine, also what is called evidence-based medicine. And he has openly invited, when you take the salutation to Dhamma, Swakhato Bhagavata, that Gatha, right, he has told my Dhamma is immortal. That means it is for every time. You can come in, examine and learn. Of course, the learning will depend on the amount of wisdom that you have. Right. Now, here up to date there had been not a single word of addition or deletion from Buddha's Dhamma. But what has happened to Western medicine? What is written has been rejected, added, deleted. There had been controversies, still there are controversies.
So
right?
keeps on changing.
Keeps
all
on
over
changing.
Again.
And this has also been reiterated in first Dhamma Sanghana by the venerable Arhats who congregated. The first question that Arhat Kashyapa, Mahakashyapa had asked is there anything to be added, is there anything to be deleted? The unanimous answer was there is nothing to be deleted, nothing to be added. So, up to now it has remained the same, right. So, what Buddha has described is immortal, Dhamma is immortal. And his main, why did he not practice medicine? Because the main obligation of a Buddha is to preach Chaturarya Satya.
Yes.
Right. And secondly, if he embarked on treating patients, there would have been no end, and he won't be able to actually do other things to make people to attain Nibbana if he started doing medicine.
Yeah.
So that is one of the things, and the final target or goal was to annihilate all the diseases forever. How can you do that? By getting somebody to attain Nibbana.
Yeah.
So there's no birth.
That's what I was just about to ask, because isn't he anyway the best doctor ever?
Yes.
Because
so he actually, you will be surprised when I go into the details of what he has described. As you said, in one or two words, you can say he is the greatest healer or the doctor. So that is why the Lowada Sangara author has told Sathata Vanabhava Dukta Vedana, right, for all three worlds, right.
Yeah.
So shall we just touch on what he has now? When you take Western medicine, right, you know there are certain branches of Western medicine, anatomy, physiology, biochemistry, those are the three basic sciences. So Buddha also had used these three basic disciplines to describe matters. So if you take his description of anatomy, now mind you, Buddha described this without any dissection. Without any dissection.
Yeah.
Right. So all these due to what he has learned and achieved through his long journey of samsara and using his wisdom. So what has he told? Can I just quote what he said in this
Please do, yes.
Girimananda
Sutra.
Yes. So he described Atti ismin kayo kesa loma nakadanta tacho mansang naharu atti atti mijja wakkang hadayang yakanang kilomakang pihakang pappasang antang antagunantang udariyanang Karisang pittang senghang pubbo lohitang sedo medo asu vasa belos singanika lasika muttanti mattalunga. So what do these stand for? Right now he has said there are in the body there are head hairs, body hairs, nails, teeth, skin, flesh, sinews, bones, marrow, kidneys, heart, liver, pleura, spleen, lungs, the colon, the small intestinal tract, the stomach, and inside those there is feces, bile, phlegm, pus, blood, sweat, tears, fat, saliva. He has also said there is nasal mucosa, synovium, and urine, and the brain. Now these are described in contemplation of foulness. So what we see now after so much of dissection are the same.
Definitely.
So he described this without seeing any iota of anatomy, human anatomy, using his wisdom. So it's great.
Yeah, definitely.
It's great.
Yeah.
So saying that, then what the physiology and biochemistry he described. Now he told the body or the matter is made up of Satara Mahabhut. Apo, Tejo, Vayu, Patavi. Now Apo is water.
Yeah.
So where do you see water? 60% of our body is water, right? Even if you take an individual cell, the major component is water, and you get what we call basically intracellular fluid and extracellular fluid. Intracellular fluid is the fluid which is inside a cell. Now extracellular fluid is the fluid which is outside the cell, and the fluid outside the cell is once again classified into intravascular fluid and extravascular fluid. Intravascular fluid is which is running in your blood. It's the blood that you get about 5 liters. So he have precisely said that in the body you get water.
Yeah.
Right. And if you take an individual cell, it has various components, the nucleus, the cytoplasm, all these have water.
Definitely.
Right. If you take all your requirements, it is water which is absolutely necessary for your survival.
Definitely.
Then after that you go for Vayu, air. Where do you get air? Now if you take individual cells, you get air there, because you need air, oxygen for your metabolic activities, oxidation processes to synthesize proteins. So air is found inside a cell which is dissolved in the cytoplasm, and also there is oxygen in nucleus, the energy factories of the mitochondria, and when you go out of the cell, air is dissolved in your body fluids, and at the end of the day the air exchange takes place at the lungs. So you inhale air, you exhale air, and the lungs are the surface for that, and this is the basis of meditation for Anapanasati. Right.
Yeah.
So saying that the air is also produced in other parts, the main part is the gastrointestinal tract during digestion. So air is an integral component of the human body. Then
I think we missed Tejo.
I am come to Tejo now.
Okay, fine.
Yes, fine. Right, because I wanted to tell these two first. Now
Right.
Tejo is actually heat.
Yeah.
That is energy. Now if you take an individual cell, right, now there is metabolic activities going on, then the energy is produced in the mitochondria. Now this heat is dissipated into the body fluid, and from it is carried elsewhere, and you need this heat for your activities of the body. You have to maintain a constant temperature.
Yeah.
For that we have temperature regulators in our hypothalamus. Right. If these temperature regulatory centers go haywire, then either you can get excess of heat or you can get low heat. So it has to be a precise balance of heat. And also there are mechanisms by which we sort of control heat apart from the internal milieu. But you have your skin, you have your urine, you have your gastrointestinal excreta, you have your breath. So, to regulate heat. So, the heat is also an integral component of the body. Now, all these will get together, will constitute a cellular unit. Aggregation of cellular units will make a tissue, and aggregation of tissues will make an organ, collection of organ will make a system. So, that is my way of looking at Patavi, solid material in the body.
Okay.
So, his description of basic sciences, biochemistry and physiology exactly matches the knowledge we have gained in Western medicine. Okay?
Okay.
Now, I am not going to stop only there. Now, he has also described about Panchupadana Skandha, what we call special senses, your eye, nose, the ear, the olfaction, your taste buds and your skin. Right. So, when you take neurophysiology and neuroanatomy, now if you take for that matter eye, I will take that example, you would say that you see an image and this is transferred or transmitted to the optic nerve. The image is fallen on the retina, this is in turn transmitted to the optic nerve and the optic tract to a particular area in brain, what we call the occipital lobe, and there you get what we call the center for vision, and also you get what we call visual association cortex. So, you get some impulse, you get sort of form a picture of it in your mind, which is synthesized in your occipital cortex, and when you say Chakku Viññāna, it can take two ways. It could be Sukha Viññāna, that where you like what you have seen, and Dukkha Viññāna, where you don't like
what you
have seen. So, all these are synthesized in the memory box of the brain. So, whenever you see it for the second time, you know that I would like this sight, I would dislike this sight. So, you have what we call adherence to what you see and then a dissociation of what you see. So, that will constitute one of the Upadana Skandhas for the eye. So, likewise other organs also do the same thing. We have special areas in the brain to synthesize and sort of accumulate and memorize things. So, that is equivalent to what we call Panchupadana Skandha. So, what Buddha has preached is that try and avoid getting addicted or developing a liking towards a certain stimulus or disliking towards a certain stimulus.
Developing some sort of attachment.
Attachment, yes. So, what he has described is, we also see that in Western medicine. So, that is one of the important things one has to realize. Then next is now about origin of life.
Yeah, I was about to ask it.
Yes.
Yes. Now, so like you just happened to describe what, it was quite a lengthy answer for what I asked, what you meant by Buddhist medicine. Now, what you were referring to, what you are about to refer to is may not be directly involved with medicine, but it is it has a relationship to bioscience. I was about to ask this from you about the origin of life, because like there are so many in this world talking about it, like how did the origin of life occur and what do the scientists say and what is the latest discussion going on, because as you said, science keep on changing, and what has the Buddha said about it? Please continue.
Yes, actually now that is one area Buddha has said not to speculate, because you can't say this is the mechanism of exact origin of life. So is the Western medicine, because what we know is, right, Buddha has described 3 conditions for a life to originate. One thing is there should be a suitable prime uterus, which is the true case even now. Then there should be a unison between a male and a female, which is the case now. But sometimes we have to do this outside to create test tube babies when the normal anatomy or physiology of this reproductive cycle is not conducive. And thirdly, he said that there should be a vijnana coming once the zygote is dividing. Now, when does this vijnana comes? Now, we have no answer in Western medicine, right? But what Buddha says is as soon as the zygote starts multiplying, there should be a vijnana coming carrying the good comers and the bad comers. And the final product of the zygote or the embryo, the outcome, it is not only during the uterine life, but extrauterine life until you die is a balance between the good comer and the bad comer you have brought in with your vijnana. Now, that part we have not been able to demonstrate or describe in Western medicine. So, in Western medicine, when you talk about origin of life, there also there is no answer. We say one fine day there had been thunder, energy, water, and reactions taking place, resulting in sort of amino acid. Now, from this amino acid, the life started to develop. So, it is only a postulation, right? But we have no exact answer. And also we have this theory of evolution, but Charles Darwin had proposed. But only thing is what he says is there are certain truths about that, right? To adopt to the environment, the organisms have developed certain adaptations. But only thing is that it will not explain the exponential increase in population. So, if you are to think the apes have to get converted to a man. So, where are apes to get converted to this exponential increase in population? So, there should be some other explanation. What Buddha has told that these lives come from other animals also, right? It can come from the animal world, it can come from the world of other, from the heavens, it can come from the
other mammals perhaps?
Sorry?
Other mammals?
Other mammals. What I am saying is there are so many animal species, right? So, this life has to come or vijnanas have to come from these populations, otherwise you can't explain. So, we have no real answer for that. Then next I am going to talk about, now we have talked about evolution and things like that. Then what are the other branches of medicine? Now, before coming to that, what about this creator theory? So, if you are saying the man is created by somebody, why did he create men with deformities? Why did he create men with agony, sorrow? So, it has to be a perfect creation. So, that creator theory will not hold true when you consider day-to-day life. Now, next comes the other branches of medicine, which is pathology, pharmacology, parasitology, microbiology, community medicine, pediatrics, psychiatry, surgery, gynae and obs. Right now, I have already talked about Buddha's medicine, which he has described in Vinaya Pitaka. So, I am not going to touch on pharmacology, but there are volumes and volumes of those, but unfortunately, I am not the authority to comment on those. This is because these are on Indian medicine. What I know is Western medicine. So,
definitely.
I think it is another sort of forum for discussion, getting somebody to know about, somebody knowing about this medicine to sort of explain,
talk about it.
Talk about
Yeah.
it. Talk about that is probably thought for the future. Now, everybody knows that there had been a physician during Buddha's time called Jivaka Komara Vacha. Now, he is actually a half brother of King Ajasatha. I don't know whether you know that, because he is a son of Bimbisara.
Yeah.
Right, and he has been a leading physician at that time. So, he has performed according to the literature, neurosurgeries. He had been a pediatrician, he had been a physician, he had been a surgeon, and he has been crowned on 3 occasions as the jewel physician at that time. So, one day Jivaka thought to meet Buddha to learn more about medicine. So, he went and sat and listened to what he preached. At the end of the day, he could not listen, sort of understand anything. So, Buddha called Jivaka and asked him to go to, let's describe as snow mountain, I think it is Himalaya, and bring certain plants, which he has done, and Bhikkhu Vajrapani had helped him to do so. And Buddha has questioned Jivaka to identify these plants, and apparently there had been 4 plants which he could not identify.
Okay. Jivaka could not
identify. So, Buddha has told this is a medicine used for this particular thing, this is a medicine used for this particular thing. And Jivaka had been amazed, and he has asked Lord Buddha, do you know medicine? Right. So, Buddha has told these words. Buddha looks at the disease in 4 ways, identifying the etiology of it and how to treat it and how to sort of examine the pathology and understand the etiology, how to pacify the disease and how to prevent it. So, he is talking about community medicine, preventive medicine, and he is talking about pathology, and he is talking about investigations and treatment. So, this is Buddha's concept of medicine is the same as the concept of Western medicine. Now, it has not been a iota of difference. So, having said that, he has also gone beyond the somatic diseases and to describe the medicine for that. What is the medicine he described? To understand the 4 great truths, Chaturara Satya. And depending on how to understand, he has described various mechanisms to do so. So, at the end of you attain Nibbana and you stop getting all diseases. Now, then we go to Buddha's classification of diseases. Once again, which is said in Girimananda Sutta. So, what he says is Chakhurogo, Sotarogo, Ganarogo, Jivharogo, Kayarogo, Sisarogo, Kannarogo, Mukharogo, Dantarogo, Kaso, Saso, Pinaso, Daho, Jaro, Kuchirogo, Mucha, Pakkandika, Sula, Visuvika, Kuttang, Gando, Kilaso, Soso, Apamaro, Daddu, Kandu, Kachu, Rakasa, Vitachika, Lohapittang, Madumeho, Ansa, Pilaka, Bagandala. Now, you see this, he has described about apasmara, epilepsy, and he has described about diabetes, Madumeha. Right? Can I just go to the English version of this?
Please do.
Because I think then the listeners will actually realize how accurate his classification of diseases had been. Now, he talks about eye diseases, ear diseases, nose diseases, tongue diseases, body diseases, headache. He has also described mumps, and mouth diseases, toothache, cough, asthma, catarrh, heartburn, stomach ailments, fainting, dysentery, swelling or gripes, leprosy, boils, scrofula, that is tuberculosis, consumption, epilepsy, ringworm infestations, itch, eruption, pustules, plethora, diabetes, piles, cancer, fistula, diseases originating from bile, from phlegm, from wind, from conflict of humors, from changes of weather, from adverse conditions, from devices, that is those accidents, and the war. Then diseases will come by Vipaka, cold, heat, hunger, thirst, excrement and urine. So, that actually encompasses all the diseases which are classified under different systems.
Definitely.
So, it is it's actually unimaginable, unbelievable how Buddha has seen those diseases which would affect the human body. And actually you can when you say thirst, there are several causes for thirst. I am not going to go into details, but when he says loss of consciousness, there are so many differential diagnoses for loss of consciousness. So, he has seen all those, and he has also had other ways of treating diseases like Pirit. Now, you know the Bojjhanga Sutras, Mahamogallana Bojjhanga Sutra, Mahakashyapa Bojjhanga Sutra, then Girimananda Sutra, and also when Buddha himself fell ill, he got Chunna Thera to chant Chunna Bojjhanga Thera. So, what are, and also Vatana Sutra, right? Now, what are the contents of this sutra? Now, these are the noble qualities of Triple J. And you say, if these are true, may this illness become cured. What we call Satyakriya. So, it has had definitely a place, even now it has definite place in our type of medicine.
Definitely.
And Buddha did not embark on surgery. You know that, because that he has told, I